Kids who have ear infections, they usually have some signs and symptoms that'll tell you something. And oftentimes they'll complain if they're 3 that my ear hurts. Often they'll have a fever. It can be low grade, but it can be really high. They'll tug on their ear, and some kids will even bang their head on the wall because they'll feel the pressure. And if there is a significant ear infection, you can kind of treat it a few different ways depending on how old they are. So if they're maybe 4 or 5 and their immune system's matured, nowadays we're treating them with some pain drops and watch and see approach and have them come back in 48 hours to see how they're doing, because they might resolve it on their own. Now if you're 1 years of age and you have a significant fever, their immune system's not very good, so you're probably going to want to treat them with antibiotics. Nowadays we don't use antibiotics as much as we did in the late 80s and mid 90s because we used them a lot, and even for just a cold. And so in that case we created some resistant bacteria, so we've kind of backed off on using antibiotics and trying to be more judicious with that. The swimmer's ear is an infection of the external canal versus the middle ear space. And so swimmer's ears often you get when you're swimming because the environment will be moist, and the swimming in the pool makes it more basic. Swimmer's ear can not only occur in the swimming pool, but it can occur giving somebody a bath or just when it's hot and you're sweating, because the environment in the ear canal becomes moist. You can at home push on the tragus, which is right here, or pull on your pinna, which is the external ear, and if that hurts when you do that, it's more likely a swimmer's ear than a middle ear infection. And so really what you do in certain situations where you might be more likely to get it is use a little alcohol to dry it out, and they have preparations over the counter called swimmer's ear, or you could make your own with half rubbing alcohol and half distilled white vinegar, which has some acid in it.